Good morning. I'm Dan Carey, Virginia Secretary of Health and Human Resources. Thank you all for being here. I look around the room and see a great number of our community partners behind us. Thank you for being here for today's press conference. We're here to give you updates on what we in Virginia are doing to plan and prepare for COVID-19, coronavirus, here in Virginia. Coming up, you'll hear from our State Health Commissioner, Dr. Northam Oliver, and our State Epidemiologist, Dr. Lillian Peek. But first, it is my pleasure to introduce another physician, the 73rd Governor of Virginia, Ralph Northam. Governor.
Well, good morning, and thanks to all of you for being here this morning. We are here today, as our Secretary said, to update you on the Commonwealth's actions and plans around the coronavirus, COVID-19. My top priority is to keep Virginians safe and also to keep you informed with up-to-date and accurate information. I want to assure Virginians that we are actively monitoring this new disease and its spread. To date, there have been no positive cases of coronavirus in Virginia. But if and when it appears in Virginia, we are prepared. We began our planning in January, within days after scientists first identified the virus, by establishing an incident management team of public health and safety experts. I have full faith in the experience and leadership we have at the Virginia Department of Health. Our state epidemiologist, Dr. Lillian Peek, and our Commissioner of Health, Dr. Northam Oliver, both have deep experience in public health. In just a bit, you will be hearing from our Secretary of Finance, Aubrey Lane, Dr. Peek, and Dr. Oliver. Dr. Peek, who is leading our incident management team now, was the health director in the Thomas Jefferson Health District during the H1N1 flu outbreak. This team's job is to coordinate and plan Virginia's response. It includes people from across state government, including the Department of Health, the Department of Emergency Management, and numerous other agencies. The team meets daily to share information, and they are in regular communication with our partners in government and the private sector. We're working to make sure that our health providers in communities around the state are prepared. This includes our first responders, our hospitals, our local health districts, and healthcare providers. Our public health lab, the Division of Consolidated Laboratory Services, will do its own testing of potential coronavirus cases, which means we no longer have to wait for test results from the CDC in Atlanta. We can get results and respond much faster when we do it right here in Virginia. I have received regular briefings since the beginning of the year, and this has been a standing agenda item at our weekly cabinet meetings. Our team has briefed members of the General Assembly, and I have spoken with General Assembly leaders about the importance of having the necessary supplies in place. We all agree that Virginia will have the resources we need to respond. The Commonwealth is taking this public health issue seriously, and Virginians should too. You need to know this. Our Department of Health has some of the country's leading public health experts, and they are on the case. As governor and as a physician, I have great confidence in their expertise. In fact, National Health Policy Organization Trust for America's Health just released its annual Public Emergency Preparedness Report. Virginia ranked in the high performance tier, as we have for the past several years of that report. In particular, we scored highly for emergency management accreditation, hospital safety, and for our public health lab testing capacity. I'm proud of this ranking from a respected, non-political national health organization, and it underscores the faith that Virginians can have in our public health system and its leadership. It's also important to know there are some simple actions you can take to protect yourself. They're the same things that you should do every day. Wash your hands with soap and water. Cover your mouth and nose when you sneeze. Stay home if you feel sick, and avoid touching your face. Lastly, I want to acknowledge that a lot of misinformation is out there about the coronavirus and its impacts. I would discourage everyone from spreading rumors or misinformation. You can always get accurate, reliable information at the Virginia Department of Health website or the CDC website. And these numbers and websites are on these posters to my left and right. Both of these health organizations will update those sites regularly, so you can be sure of having the most up-to-date, accurate information. Coronavirus is serious, and we are taking it seriously. We have a plan, we are executing it, and we are prepared. Our team will continue to closely monitor developments and keep the public informed as needed. With that, I'd like to thank all of you for being here today. I'd like to thank the media for making sure that our community, our Commonwealth, receives this message. And I would like to turn this over now to Secretary Aubrey Lane, who will review the resources that we have available in the Commonwealth of Virginia to handle this virus. Thank you. Thank you all.
Thank you, Governor. Thank you.
Good morning. Obviously, today is really about the governor's efforts working with his team to confront this situation. But as he mentioned, it's going to take some resources. The shorter answer is the governor and his team has all the resources available to him to be able to do this effectively and efficiently over the short period of time and over whatever this course takes us over the next year or so, depending on how things materialize. In days, as you might imagine, the team has already been working efforts, but it was determined we're going to need about $3.6 million over the next 90 days to mobilize efforts, and a big part of that has to do with the personal protection equipment that will be necessary to provide for all our health workers and all the people responding, in addition to communication material going out to the public, along with the actual cost of all the people here working. So that money has already been available to the governor under his current authority. We have been in direct communication with the money committees and the senior leadership of the legislature, and they agree with this, and that we have monies on hand that the governor is able to tap to make sure those resources are currently available. If this develops in the future, the way we've been briefed, and you'll hear more about that in a few minutes, over the next 12 months, over and above that, there could be a potential for another $6.5 million that may be necessary in direct cost, again, for the personal protection equipment, the communication materials, the other items that will be available at the disposal to meet this particular issue as we work forward. So as it's a fluid situation, it continues, and I just would assure the audience here that whatever resources are needed will be made available. Obviously, this is something that the legislature is working hand in hand with the governor's executive team. So anyway, thank you very much, and Governor.